Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Good morning and welcome to Health Talk, and all of us here hope that you don't have the flu or feel like you're getting the flu. We also hope you're not sliding off the road this morning. I'm Jim Stallings. Good morning, Kay Murray.
Good morning, Jim Stallings.
And with us in the studio this morning is Dr. Nalini Casey. She is a pediatrician with Cardinal Pediatrics affiliated with Mon General Hospital. Good morning.
Good morning.
All right. That darn microphone.
You don't like it, do you?
Well, it just doesn't work, and I don't know why I don't get somebody in here to work on that a little bit.
And hope that you can get into it too.
There you go.
All right.
How's that?
There you go. Good morning, Nalini Casey, pediatric doctor with Cardinal.
Good morning.
And it is flu season. And I heard there's at least 10,000 in West Virginia. Maybe it's more than that. Maybe it's 20,000 now.
Numbers are going up.
Oh, yeah. I mean, the flu season's significant this year. It's a very early flu season, too. Usually we start to see flu in about January, February. This year, we started to see our first flu cases right around Thanksgiving in West Virginia.
And is there a difficult strain this year? Because I thought we're always ahead of the game when it comes to a flu shot.
It's a hit and miss, and they do the very best they can to predict the strain, which strain of the flu will be there. But seems like it is hitting some, but there are different strains that are out there that are causing sickness. But people ask me all day long, well, we're in the middle of flu season. Should I get a flu shot? And the answer is definitely yes, because even if you've had the flu, at least you're not going to get the other strains that the flu shot is covering.
So that's how it explains that it was reported in the news yesterday in West Virginia. People had reported that they got the flu even though they had a flu shot.
Yes, and we've been seeing some of that too, but I can't imagine what it would be like if we didn't get the flu shot or if we didn't have kids getting the flu shot. Then they would be getting all kinds of flu.
The main ailment I've been hearing about, especially here at the radio station among some people, is some kind of stomach problem.
Yeah, it's starting out like that. A lot of kids are starting out with vomiting, and then progressing on to, and then the parents say the same thing. Well, I thought we were getting better, and I thought we had a little reprieve, and then bam, it's hitting them again with the fever and the runny nose, the cough, the sore throat. And most of the time, the flu itself is miserable, but not deadly most of the time. But what happens, especially in these little kids, they're ending up with secondary infections. So not only are they off school and the parents are off work taking care of them for a week, and then they come back with secondary pneumonia or secondary ear infections.
What is the difference? How will we know the difference from flu to just a good old-fashioned cold?
Well, the flu is hallmarked by fever. So a cold, runny nose, watery eyes, constantly blowing your nose. But a cold doesn't always go down into your chest. If you have asthma, that cold may go into your chest no matter what, and it may be a tough game, something difficult to figure out. But for the most part, there's no fever. The flu, you have body aches and high fever, and the kids really look rough. They look and they get dehydrated because keeping up with the fever is hard to do in terms of fluids. So
you sound like you have a little cold.
I always sound like I have a cold. I don't know.
Yeah, that's her voice.
That's just my
she
voice.
was coughing too before we came in. So you sound like you have a little cold.
That may be something else.
Oh, thanks.
I won't ask what that was about.
I don't even know.
Okay, good.
If our children get the flu, do they just have to suffer through it, or is there anything they can do?
Well, the biggest thing is they've got to come in early. So parents always apologize. They say, oh, well, maybe I brought her too early. But in this case, no way. You never can bring a child too early when you think that they may have the flu, because we have a rapid test at Cardinal, and we can at least test whether the flu strain A or strain B is positive. And if they're positive, if we can get Tamiflu into them within 48 hours, then it can shorten the course of influenza. And also we get a nice baseline look at that child so that if they do come back with a secondary complication, we're able to jump right on it. Also, we can say to the parents, hey, look, these are things to watch for.
I heard on Dave Weekly's show, Jim's, some guy call in, and you could tell he really was feeling bad. You know, you could tell by his voice and so forth. But he said he had the flu. And he says, first year I've gone and had a flu shot. Now I have the flu.
Everybody says that.
I know, but there's so many different types of flus. When we get our shot is not going to be a guarantee that we're not going to get some type of flu.
That's true. But at least getting the shot guarantees you that you're not going to get that kind of flu. So if there are 3 strains and you've gotten a flu shot that covers 2 strains, well, that's 2 weeks of your life that you're not going to be sick.
Now, what worries me, and not in West Virginia, but in some other states, people have died from the flu. And one of the big cities, I'm thinking Chicago, but it could be another, they've actually set up tents outside of the emergency room just to handle people with the flu because they didn't want them to carry it into the hospital. So they're setting up these special tents. So this is a problem around the United States right now.
Oh, yeah. And even on CNN today, and I bet we're going to get a lot of calls today, they had an episode where a young teenager had died from the flu. It's not necessarily the flu that is causing the deaths. Again, it's the secondary infection. So children and adults will get the flu and they think, okay, I'm sick, I've got the flu. The doctor told me I had the flu, but I didn't go in till the 4th day, so I can't take Tamiflu. And so about the 5th or 6th day, they're still really sick and they're not really appreciating. They continue to tell themselves they have the flu, not appreciating that maybe they do have a secondary pneumonia or a secondary ear infection or maybe. And again, people that have underlying respiratory illness, they get the flu and they're going to have a much worse time with it. So if you're an asthmatic and you get the flu, it could really kick off that asthma. And, we've found many of our kids end up really struggling.
Wouldn't you agree, though, if that teenager, if he's healthy in every other way, that's really unusual? There may have been an underlying problem there.
Again, in that case, I think the parents said, well, we thought he was getting better, and then then he got worse. So it may have been a secondary infection.
Because I think of the seniors out there that would get something like this, and then they're very vulnerable. But you don't think of young people dying with the flu.
Exactly.
You really don't.
But we do have a vigilance. Now, there's also another disease called RSV, which is a respiratory virus that also generally tends to hit later on in the season, February, March, and just around this area, we tend to see it later. Again, that one hit early too this year, and what we're seeing is a combination of kids picking up the influenza and then getting RSV at the same time, and that is just devastating. These poor children, especially the very young ones that are coming in 6 weeks old, even 1 to 2 years old, that have a co-infection with these two viruses.
What is that again? Explain that.
It's called RSV, and it's called, the big name is respiratory syncytial virus, and what it causes is bronchiolitis, and in adults we would say, oh, that's bronchitis, but it's like, in young children, it affects the very kind of ends of their airway, and it's like they get glue in their airway. So add that to the flu, and boy, you have a really sick kid. So
are they going to start out with an earache, or are they going to start out with what you seem to be a cold?
Just starts out as a cold, and you have a couple days of super, really runny nose, and then all of a sudden it goes into the chest. And so and we have a test for that too at Cardinal. So it is so nice to be able to have your child come in and say, okay, you have RSV but not the flu, or you have the flu and RSV. That way we know. And
is that a blood test? What type of a test is it?
It's a little nasal swab, and it doesn't hurt. And it's just painless. And then, they can have a co-infection, a third infection, maybe with strep. And so we want to make sure that we look at all of the angles. And I think it can be frustrating for parents sometimes to not know what their child has, but to know what they have and kind of be able to explain that course to the parent is very important.
Yeah, and being exposed in nursery schools and daycares and, of course, schools in general.
Yes.
We tell our kids to wash their hands, but we know they're not going to have the opportunity as much as they should. Should they carry around a little bottle of what Jim just put on his hand sanitizer?
They can.
Does it really help? Or
I guess it does, but if you go into a kindergarten, first grade, second grade class, they may wash their hands, but 2 seconds later, then they're picking their nose. So, then they're like holding their other person's hand and chewing on their friend's pencil. And I mean, it just does, it's really hard.
I went to a Christmas show at my granddaughter's up in Pittsburgh.
She picked her nose.
And
she did not.
My granddaughter would not do that.
No, she's a little angel.
But no, there was a little boy in there that should not have been there. I mean, he did not feel well. He was sneezing over everything, and he would just sneeze, and it would just go over everything, and then he'd just go back and play, not noticing. And I'm thinking, oh my goodness, he shouldn't be here. Yeah. But it's Christmas time. You don't want your children to miss out on things.
Yeah, and a lot of parents ask that. They say, well, yeah, even though they have the flu, can they still do their Christmas program? And I always leave it up to the parent, but my kids stay home.
You should say no. Stay home. You're going to expose other children to that.
Well, I do, but ultimately the parent's the expert of the child, and so I don't want to overstep my bounds. But I do, I keep my kids home when they're sick.
For safety's sake, yeah.
And I hate to think of kids in school really sick. They're not really learning anything if they're very sick, and it's hard on the teachers because they're not nurses, and the school nurse is often overwhelmed too.
But they sing and get a cookie, so.
This is Mon General's Health Talk with Dr. Nalini Casey. The number to call to be on the show, 304-296-0041.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Dr. Nalini Casey, our guest with Cardinal Pediatrics. Several locations. I understand you're expanding a bit, too. You're adding psychology or something?
Yes, we are. We have Tracy Berry-Harris. She's our psychologist, which she has been just a wonderful asset to the practice so far. It's absolutely essential to take care of children's mental health as well as their physical health. And she doesn't just see the child. She takes the whole family into consideration. And so she'll see children that are having learning disabilities. She saw my own little girl a couple weeks ago because Ruby was having some difficulty reading, and it was just helpful. You couldn't believe how thorough she is. Anyway, she sees kids that probably have some attention problems, maybe with ADHD. She'll see children with depression. And
children that are stressed. I'm finding that to be true. Kids really stress themselves out.
Right. And she's not, the therapy that she does really does work on giving children tools that they can use to make their life better every day in terms of the stress and anxiety and depression.
We have a call from Brandy in Morgantown. She has a call about her RV. No, it's not your RV, is it?
RSV.
Hi, Brandy.
Hi. I was just wanting to let everybody know I just have a 1-month-old, and he was just in the hospital on Friday over at Ruby, and he had RSV, and they were sucking him out in there. He had a really bad congestion and everything, and they let him out Saturday, and he came home, and we tried to suction him out. I got a Graco baby nasal aspirator. It's battery-powered.
Wow.
And I thought it would work real good. I thought it would have good suction and everything, and it turns out that it didn't. And we tried to use the blue nasal bulb thing that they give you at the hospital. And I ended up having to take him back to the hospital on Monday, and they readmitted him again.
Oh, no. Oh my gosh. I'm so sorry, Brandy. That's horrible.
Yes, it was awful.
RSV is just devastating, especially to young children. Kids, very young children, get their nose so stuffed up with mucus that they can actually just stop breathing. And I think that's what Brandy's trying to describe. And that great big blue nasal bulb doesn't really help because it's twice the size of the kid's nostrils. So it's very difficult especially a new mom, a 1-month-old.
Yes.
And you're tired anyway, and the baby doesn't want to eat.
And I got 2 other boys, and they were both sick with RSV also, but they're older.
But it doesn't matter. They still get sick, don't they, Randy?
Yes. Yeah. It's awful. But I wanted to let everybody know I got online and found this thing called it's the Arena Baby Vac nasal aspirator, and it hooks into your vacuum cleaner, and it works so good. It is the best thing I've ever bought in for anything like that.
Have you heard of that?
No, I'm going to look it up. I'm going to Google it as soon as I get to the office. What is it again?
It's called the Arena Baby Vac nasal aspirator.
How do you spell Arena?
Arianna.
All right, that ought to be good enough for you
How's
to
your
Google.
little boy?
Oh, he came home yesterday
Good.
about 7 o'clock, and he is just, if I use this on him, it clears him out so good. He does not have any problems breathing. he's sleeping more comfortably now, and he seems really at peace, and he's happier. He's eating better now, because when they're congested like that, they can't eat good, they can't sleep good.
You're right. Thank God he's better.
Yeah, he's just so much better. But I wanted to let everybody know about that, because if any of their kids are sick, and it's from infants all the way up to a 6-year-old, you can use it on.
So it doesn't cause too much suction? Like,
no,
suck your nose off or something?
Yeah.
All right. Thank you so much for sharing that story with us. That's why we do the show, for people like you. Thank you so much.
Thanks, Brandy.
Friend of mine, he's not a child, although he acts like a child many times, but he had major surgery at a Clarksburg hospital recently, and I went to see him, and he says, I now have MRSA. And I had to look it up. I mean, I heard of it before, but it's MRSA, and I had to, be careful in the room, disinfect, and all of this stuff. Is this something he picked up in the hospital, possibly?
Probably he did pick it up in the hospital. But MRSA stands for methicillin-resistant Staph aureus. And so when people say, I have a staph infection, they're referring to usually Staph aureus. And that is a bug that can cause mostly skin infections. It could cause pneumonia and blood infections as well, but it is on our skin. We have Staph aureus on our skin. And when we breach the skin and get that Staph aureus into our blood, it becomes infected, and it's a very purulent kind of pus-like infection. And it can be very serious. It can happen quickly. So in the past, we could just give amoxicillin for that, or we could give and then later on it became resistant to amoxicillin, so we'd have to give like a specially made penicillin, and that's methicillin, oxacillin, different ones. And now what we're seeing is resistance to those special drugs. In fact, it used to be the exception. When I was a med student or resident, and a baby would have methicillin-resistant Staph aureus or MRSA, we'd go, oh my gosh, we've got to, this is really rare. We can't let this get out in the hospital. Now kids come in at least twice a day, once a day with a MRSA infection. And what we do is they'll have a big boil or a big bump of it, and we will pop it in under sterile conditions and then send that culture off, and it does come back saying it is resistant. So we see a lot more of it. And there are things you can do. I don't know about the older crowd, but I know in the little crowd, we have kids do we put them on the appropriate antibiotics, because there are antibiotics for MRSA.
But they shift all the time. I mean, MRSA seems to reinvent itself, so to speak, to fight certain antibiotics.
Right, and so at least we've got 2 antibiotics, clindamycin and Bactrim, that we use we use a lot in kids, and I'm sure at some point we'll see resistance to those as well. But, when your child has MRSA, it is contagious. So, again, it's hard. It's really hard for these parents who have to work full time. And yes, their kid might have MRSA, but they can't send them to daycare. They can't send them to school. So there are parameters where we try to say, cover it up and move on.
We're talking with Dr. Nalini Casey this morning, and you are listening to Health Talk on WAJR.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
I must say, Cardinal Pediatrics is somewhat of a success story in this town. The way you've expanded, you grow, you add people, you have more than one location. I mean, that's really a remarkable success story.
Yep, Dr. Malone and Dr. Wood own the practice, and they've done a wonderful job with the expansion. Our Jerry Dove Drive location just opened too, so make sure you visit us there, 7:30 to 4, and walk-ins from 9 to 2.
All right, and again, you're located in Suncrest Town Center and over by Cheat Lake, right?
Yes, we have an office in Suncrest Town Center and one at Cheat Lake.
And is there one specific number we should call if we want to ask some questions or get some information or make an appointment?
Yep, we have a website that's awesome. And we also have a number, 304-599-8000.
All right. How do you spell your first name?
Nalini, Nalini.
Yeah, so we don't usually do that on this show, but I thought maybe people want to know how to look you up.
That's
Nalini
true.
Casey, Dr. Casey, thank you so much.
Thanks for having me.
You've been listening to Health Talk, brought to you by Mon General on the voice of Morgantown, WAJR.